Our first speaker this morning is D.A. Henderson. All of the people in the front of the room know who he is. Some of you in the back may not. D.A. was an EIS officer back in 1955. He was the first head of the surveillance section at CDC. He did much of the groundwork of implementing the idea of smallpox eradication, and then went to Geneva to head up the WHO program of smallpox eradication. After he finished that job, he took on a more difficult one as Dean of the School of Public Health at Hopkins until 1990, and since then he's been freelancing, a little bit in the White House, a little bit in the Department of Health, Education, and Welfare, and DA, you got 10 minutes.
Thank you all very much. I'm delighted to be here. This is a grand event. And I must say, we've had so many coming back for this affair. I thought, I don't think I could get anybody at my college class to begin to accommodate this percentage, or my medical school class either. And yet, this program's been dead for 30 years. I mean, we haven't had anything to work on. And this was the problem when I finished up the program. It was a question of, what do? You become the world expert in smallpox. And you have no marketable skills. And so what do? You become a dean. And that's what I did. Just a little advice, Jim. But for all of this, has been a career-altering experience, at least an experience that we would never forget. Very recently, I think I've heard much more about polio, or about smallpox for another reason. There's been a lot of discussion of just how easy smallpox really was. I mean, this was no problem. You have a great group, sort of a general staff in Geneva. You send the people out with a good vaccine. They simply vaccinate everybody, and it goes away. And as they've gone further in the polio program, they've begun to realize it's a little more complicated than that. And you'll hear today some of the complications that are there. May I offer the thought, I've had most recently a number of queries from the press, how did you feel on May 8th, May 1980, when it was the Declaration of Eradication. And they've said, you must have been very excited. And I thought about it a while, and that isn't the way I felt at all. I was sad. I was really sad, because I felt now I've netted the wonderful 11 years here, or really 14 years, going out in the field, working with people, getting to know the country. And I realized it would never be the same. Coming back as a tourist and staying at the Intercon and God knows where, I'd never be able to enjoy a country again. So in a sense, I was sad. But at any rate, it was an interesting experience. Today, I'm to provide the transition for you to where we were very briefly and go on to introduce what we're dealing with today, which are the last endemic countries. Now, where do I go from here? Somebody going to bail me out here? No.
DA and I have the same problem,
yeah,
modern technology.
Well, I'll give it a try. No, that's not it. Oh, here we are. That's it. All right. Let me see, where is it?
Gotcha.
Okay. All right, it's a brief introduction to today. Let me remind you, this is 1967 as the program began, and you can see here we've got the countries that are in dark are the ones where we have endemic smallpox. Brazil, the African continent, south of the Sahara, most of the countries, and some in Asia. And this was the beginning. The 18-country program became a 20-country program eventually, which was supported by USAID, and CDC had the lead and provided the technical assistance, guidance, and what have you. It was an important program for another reason, and that was the World Health Assembly was debating whether to go ahead with an intensified global program or not. And in the 1966 World Health Assembly, they went to a vote, which they rarely do, debated for 3 days. There had to be 58 votes in order to go ahead with an intensified global eradication program. 60 countries voted for it, and the others did not. And they were afraid they were failing in malaria. We don't need another debacle, lose more credibility for WHO, and so it just barely made it. But the fact that this was announced only about 9 months before, that the U.S. was going to support this, was kind of the added kicker that got this through, and we started the program. That was in the beginning. In May of '65, when CDC we proposed this program, and in November of '65, we had formal approval. In January, we sent the plan and budget to USAID. It provided for 150 million doses of smallpox vaccine and 33 million doses of measles vaccine. It was smallpox eradication and measles control. And then in May '66, when the WHO, World Health Assembly, decided by the 2 votes to go, and at that time I was called to the Surgeon General, and the Director General had said, look, I don't believe in this program. It's going to go down the tube. You Americans have been responsible for pushing us through, and I want to have an American running the program. So when it goes down the tube, they will see there's an American holding the bag with WHO. And at that point, I was ordered to go to Geneva. I pointed out that in the Public Health Service, we just don't send people around. We don't order them to go. We give them career options. We talk about that. They said, this is your career option. And if I don't take this, he said, candidly, you're fired. So I said, you're serious? He says, I'm serious. And go for 18 months, and but if it gets really bad, I'll pull you out. And so we went. The WHO resources were $2.4 million per year, and whatever we can come up with in the way of donations. That was for the world. We had a full staff at headquarters of 9, 5 medical officers, and we never had more than that. It was a fairly lean administrative group, to say the very least. And we look at the resource comparison, just so you know where we stood. The CDC, as near as I can calculate all this, the average budget per year was about $6 million. And the CDC was not about to solicit donations. That was not in the, this was to cover the costs. WHO had $2.4 million in anything we could get. And counted in that 4.6 million average were Japanese Peace Corps, US Peace Corps, Austrian Peace Corps, Russian vaccine, etc., etc., etc. I think got 20 motorcycles from Korea. I mean, it's the whole thing. Our headquarters staff was 9. We had 6 in the regions, and we had, at that time, 25 medical officers and 28 operations officers. The thing of it is, in the whole program, counting CDC and everything else, we never had more than 150 people, internationals, in the field working on this program. So compare that with some of the figures we had yesterday on the programs. It was a very different scene. And in some ways there was an advantage, because we really had to involve the nationals, because they were the ones that were really going to do the job. After West Africa, we had Sudan and Zaire. Those are on the same scale. They're big countries. Zaire was a real problem, a nightmare of a problem. It was unbelievable. It made it. But Pierre Ziegler and Leki Boti were the 2 people in Zaire who made all the difference. In East Africa, this was largely done by the countries themselves. with the oversight of a remarkable Russian, Ivan Ladny, who traveled throughout these countries, pushing them, working with them, encouraging them, and they came free. And finally we had Southern Africa, again, a fairly large chunk of countryside here, and they had done pretty well, except South Africa kind of lagged. They came around, and at the last minute Botswana got infected, and Gary Prestes, a Peace Corps volunteer from Zaire, took that on, and that was the end of that. So our last cases occurred, Western and Central Africa, believe it or not, in May of 1970. The program only started really in January of 67. Eastern Africa, February of 71. Zaire and Sudan, June of 71. Southern Africa, December 1970. Except the one instance with Botswana. The Americas were free in March of 71. Indonesia, January 72. Even Afghanistan came round, and here we are, September of 72. And that was all that was left. This was the summer of 73, the miraculous summer of 73. And you say, what's so miraculous about the summer of 73? Well, I would say it was like August 1939, shortly before the Germans marched into Poland. Or it was Saturday, December 6th, 1941, just before the Japanese hit Pearl Harbor. So it was a very pleasant time in a way. Here we were. Smallpox was present in only 5 countries in the world. There were programs in place in all of them. They certainly were not ideal, but we had a structure and we had reporting. There were large quantities of freeze-dried vaccine available. We had finally managed to get enough vaccine production going throughout the world so we could guarantee freeze-dried smallpox vaccine. There was essentially very little civil war. Ethiopia is always carrying on some civil war, but there was not a big problem as it became a bit later. And we could call on a veteran group from CDC in Europe, plus program veterans from Indonesia and Africa, if we needed people, if we could afford them, because we were still getting our $2.4 million a year, and that was it, and so we were skimping very much. So that, in a sense, is the introduction to this period, which I would call the most difficult, taxing, chaotic, frustrating period of the entire eradication campaign. It was a nightmare. And I say we succeeded, but only because of heroic efforts by a remarkable group of nationals and a remarkable group of internationals. And people who worked night and day in the worst conditions and really hung in there. You'll hear from some of them today, and I think you get some flavor of what it was all about. But from this, we finally came to October 26, 1977, when Ali Malan, the last case, occurred. Between September of 73 and October 77, it was an exciting time. So with that, David, the introduction, I hope I'm within 10 minutes.
Thank you. He did pretty good on time. He did very good on history. The one comment that I would make is that he said after he eradicated smallpox, he became a dean. Jim Curran, after he eradicated HIV, became a dean.